Okay, so today we are talking about psychological therapies or approaches to treating psychological disorders. So there are several different approaches that you could adopt, and you'll see that many of these particular approaches directly align with the theoretical perspectives that we discussed way back in Chapter 1 at the beginning of the semester. So first, we're going to start with biological treatments. And in particular, biological treatments focus on the use of prescription drugs to treat psychological disorders. One particular type of drug to treat disorders comes to us from antipsychotic drugs. Antipsychotic drugs are used to treat schizophrenia most effectively, okay? So people who are diagnosed with schizophrenia are almost always taking some kind of medication. And these antipsychotic drugs are really good at relieving the positive symptoms of schizophrenia. So remember, the positive symptoms are the presence of something that normally wouldn't be there. So for people with schizophrenia, positive symptoms directly relate to things like the delusions, which, remember, those are false beliefs. So maybe believing that you are Jesus Christ or believing that you are the embodiment of Elvis Presley. So they're good at treating the delusions, one of the positive symptoms, and then hallucinations, another positive symptom of schizophrenia. Hallucinations are those false sensory experiences. So seeing things that aren't there, hearing voices that aren't there. So these antipsychotic drugs are really good at treating those positive symptoms like delusions and hallucinations, but they're not great at treating the negative symptoms. So the negative symptoms represent the absence of something that would normally be there. So for people with schizophrenia then, oftentimes they experience a lack of interest. So this is apathy, right? They're just not interested in things like interacting with other people, engaging in any kind of activity whatsoever. Oftentimes they have problems showing appropriate emotion. So they'll show no emotion at all. So if you told them something that was really funny, they wouldn't react in any way whatsoever. So that's this concept of emotional flatness, and then a limited ability to interact with others as well. Other biological treatments include antidepressant drugs, and antidepressant drugs are not only used to treat depression, but they're also used to treat anxiety disorders. Phobias, remember, are a particular type of anxiety disorder, as is obsessive compulsive disorder. So antidepressant drugs are excellent in the sense that they're not addictive, so they're not habit forming. They're equally effective. There are different classifications and they seem to work pretty well, but they can have some unpleasant side effects. So individuals who take antidepressants might experience things like headaches, weight gain, or dry mouth as side effects. Most of the time though, the relief that individuals get from taking antidepressants outweighs any of the negative side effects, and so they continue to take the antidepressants despite experiencing some of these unpleasant side effects. Anti-anxiety drugs, tranquilizers, might be administered as well as another option for treating mild anxiety. One of the problems with these tranquilizers or anti-anxiety drugs is that if you go to see a general practitioner, so this could be like your family doctor, and you talk about problems with mood, you talk about problems with anxiety, your general practitioner will likely give you one of these tranquilizers. And oftentimes this leads to an overprescription of these tranquilizers for individuals who might actually benefit more just from entering some other form of treatment, specifically some other form of therapy, like a cognitive behavioral model, as opposed to just giving individuals a drug to treat their difficulty. There are other forms of biological treatment. So one is electroconvulsive therapy, ECT, also known as shock therapy. So in shock therapy, this is a procedure where basically your brain is given some kind of shock, brief electrical current, and it's used to treat severe depression. We don't know why it works, so the jury is still out on that one, but we do know that it does work. This is only used as a last resort. So if you have tried all other types of treatments and nothing seems to work for your depression, you might engage in electroconvulsive or shock therapy. The effects of ECT are usually short-lived, so that means that individuals will need to continue receiving shock therapy at various time intervals. In the video link that you should watch on ECT, you'll see that some of the individuals in the video go as often as once a month to get electroconvulsive shock therapy. Again, we do not know why ECT works, but it does seem to work with severe cases of depression. Okay, so other approaches to treating psychological disorders, taking us back to our friend Sigmund Freud with psychodynamic approaches. So Freud's particular form of psychotherapy is called psychoanalysis. And remember, Freud really emphasizes exploring the unconscious. So remember, he believed that there are these parts of the personality, the id, the ego, and the superego, and they're constantly in conflict with each other, and we are motivated, all of our behavior is motivated by those unconscious drives of sex and aggression. So Freud's form of psychotherapy, the goal is to make those unconscious motives, those unconscious conflicts, conscious, and he called that achieving insight. When you make your unconscious motives and drives, when you bring those into your conscious awareness. Freud also championed a particular concept in psychotherapy that's actually used across multiple different theoretical perspectives, and that is this concept of what's called transference. So in transference, the client basically starts reacting or interacting with the therapist the same way that this client interacts with other individuals in the client's life. So for example, if I am working with a client, the client might start behaving towards me the same way that this client behaves towards her mother or her sister or her father, and starts basically transferring the emotions that she has towards her mother or her sister or her father onto the therapist. And then you can kind of play out those potential interactions between the client and the therapist. So that's the concept of transference. Behavior therapy. So behavior therapy is built on those principles of learning, of behaviorism that we discussed in chapter 5, I believe. So with behavior therapy, you look at principles of classical conditioning, you look at principles of operant conditioning to help people change their behaviors. So with behavior therapy, we want to look at essentially what are the reinforcers. So what are the consequences that are helping to maintain a particular type of behavior. There are many, many behavioral techniques. So the first technique has to do with exposing an individual. And exposure therapy works particularly well for anxiety, particularly for phobias, because we know that when individuals are scared of something, right, when they're fearful about something, they avoid it. So let's say that you have a spider phobia, you're scared of spiders, so you avoid spiders, right? You see a spider, you run away, you freak out, you have that reaction. So over time, what happens, your avoidance of spiders actually reinforces your fear, right? It confirms your belief that spiders are scary, spiders are something that I need to stay away from. So behavioral techniques then focus on exposing you to whatever it is that you're scared of, basically forcing you to have contact with it. There are different ways to do this. So you can look at graduated or systematic desensitization, where you expose someone to what they're scared of little by little. So for example, you might expose someone to spiders step by step. So you might start with maybe pictures of spiders, then you might expose the person to a fake spider, and then expose them to a real spider. And all the while, as you're moving through this hierarchy of exposure to spiders, you're pairing it with this response of relaxation. And the idea is that you cannot be relaxed and anxious at the same time. The two things are completely incompatible. So you are then learning to pair the response of relaxation with spiders. So over time, you learn a new association. You counter condition yourself to now associate being relaxed with spiders, as opposed to before when you associated being fearful, being scared with exposure to spiders. You may also choose to do flooding, where you are exposed to whatever it is that you're scared of all at once. So for example, let's say that you have a fear of heights. If we're using flooding exposure therapy, we might take you to the Golden Gate Bridge. Very high, right? And we are going to take you to that bridge, and you are going to stay on that particular bridge until your anxiety abates, until it reduces. Okay, so that's putting you into the situation all at one time. We are flooding you with exposure. Additionally, behaviorists might have you do self-monitoring. So for example, you keep track of how often you do a particular behavior. So let's say that one of your goals in therapy is to eat healthier. A behavior therapist would then have you keep essentially a diary of the particular foods that you're eating, the moods that are associated with them, so you can really see how your behavior change is going. We can also talk about cognitive techniques. So with cognitive techniques, cognitive therapy, the idea here is that we're focusing on your thinking. And cognitive therapists really emphasize that individuals have maladaptive, irrational, unproductive ways of interpreting events, of interpreting things in their life. So cognitive therapy is particularly effective for treating mood disorders like depression. So with depressed individuals, we often find that they have these faulty, irrational, unrealistic ways of thinking. So for example, with depression, individuals often have these beliefs that everything is hopeless. My life will never get better. I'm a complete loser. Nothing is ever going to change. Things are going to stay like this forever. So those particular beliefs are really kind of black and white, right? They're all or none thinking. And so as a therapist, then you would challenge those beliefs. You would say, all right, how do you know that nothing will ever get better? How do you know that you're a complete loser? Because oftentimes, when you think in these completely dichotomous black and white terms, you're incorrect, right? There are usually some things in your life that indicate you're not a complete loser, that indicate that things could change eventually. So cognitive techniques then focus on irrational, unproductive thinking, particularly the irrational beliefs. Cognitive techniques are often combined with behavioral techniques based on this idea that your behavior and your thinking often influence one another. So cognitive behavioral therapy, or CBT, is the most widely practiced form of therapy in psychology today. So this is a form of therapy that has a lot of research support. It's very, very effective in treating a host of psychological disorders, most commonly used for things like anxiety and depression, but used for other disorders like eating disorders and personality disorders as well. So in cognitive behavioral therapy, we're going to look at your thoughts and the behaviors, right? So let's say that you have anxiety about public speaking. If you go to see a cognitive behavioral therapist to address this problem, your therapist is first going to work with you on identifying the thoughts. So your thought might be, I'm going to mess up. I'm really going to mess this up bad. So that's what's going through your head, right? So then we want to look at the particular behaviors that relate to that thought. So if you're concerned that you're going to mess up really, really badly in your speech, as your therapist, I am going to try to get you to practice, right? Because we know that the more comfortable you are with the material, the more likely it is that you are going to be able to move through this material with relative ease. So we're going to work on those particular presentation skills that are going to help you reduce the likelihood that you're going to mess up. And we might also target the thought that, okay, so you mess up in your speech. What's the worst thing that can happen? I mean, you mess up on your speech in class, big deal, right? Probably you're the only one who's going to even notice. Your classmates are going to be so disengaged, they don't even care what's going on. No one's going to laugh at you. It's not the end of the world. Other forms of therapy, we can look at a humanistic approach to therapy. And remember, with our humanists, so these are people like Carl Rogers, Abraham Maslow, they focus on that idea of self-actualization, right? Being the fullest, most fully functioning person that you can possibly be. And in this approach, we emphasize the present, right? We really focus on what's going on right here, right now. And you have the ultimate responsibility to choose your path in life. You have free will to make decisions and to change if you want to. Humanistic therapy, one particular form is Carl Rogers' client-centered or non-directive therapy. And within this particular type of therapy, Rogers emphasizes empathy with the client. So empathy, being able to see something from someone else's point of view, okay? Being able to see something from someone else's perspective. And then also unconditional positive regard. So accepting the client without judging their behavior. So for Rogers then, you may not always agree with the decisions that the client makes, but nonetheless, you will still accept this client as a person. In existential therapy, we are basically looking at existence, okay? So that's the root word of existential, the experience of the human existence. So you're exploring the meaning of life, right? What are you here to do? And with existential therapy, the responsibility is really placed on the client. And so existentialists believe then that we have a responsibility to create meaning in our lives, and we have the responsibility to deal with these issues that can become very heavy issues for human beings. Things like dealing with death, your personal freedom or free will to make things happen. This idea that oftentimes we're alienated or separated from meaning and from important people in our lives. And oftentimes we can experience loneliness in life as well. And existentialists believe that we need to grapple with these particular parts of the human experience in order to be able to have a meaningful life existence. So next, we also have family therapy or couples therapy. And within family therapy, the assumption is that all parts of the system So these are all of the people within the family unit are involved in whatever the problem is, whatever the issue is. So the problem develops within the context of the family system. And if you try to change one part, one person in the family system, it's going to throw off the balance. It's going to change everybody else in the family. So then your job in family or couples therapy is to work with each individual part of the system. So you might work with individuals, like you might work with the parents if you're working with an entire family, and then work with the entire family unit as well. And your job then is to try to determine how each individual person in the family is involved in creating whatever the problem is, and then determining the best way to go about making changes within each individual person in the system, okay? So every individual in the family is somehow implicated, somehow involved in the maintenance of the particular problem. So in evaluating approaches to psychotherapy and trying to figure out what approach is best, and we'll talk about that more in just a second here, but in individual approaches to therapy, the most important ingredient for change is this idea of what's called the therapeutic alliance. So the therapeutic alliance then is the bond between the client and the therapist. And this is the most important thing in encouraging change in individual clients. So think about it this way. If you are not comfortable with your therapist, if you don't like your therapist, you're probably not going to be comfortable then sharing very intimate personal details with the therapist. And you need to be able to do that, right? To be able to move forward, to be able to enact real and lasting change. So the therapeutic alliance then is the most important ingredient for change, regardless of the form of psychotherapy that you choose. There are, though, particular types of psychotherapy treatment that are the most effective in treating particular psychological disorders. So the research support indicates that cognitive therapy is excellent in treating depression. Anxiety disorders lend themselves quite well to treatment using exposure techniques. So these are those behavioral techniques. If you have problems with violence, particularly with anger, so these might be people who engage in domestic violence, abusive situations, cognitive therapy can be very helpful for that. Individuals who have health problems, cognitive and behavioral therapies. So let's say that you want to lose weight, cognitive behavioral therapy might be an excellent choice for you. And then for working with young children and working with adolescents who have behavior problems, so these might be, let's say, kids who are very disruptive in the classroom setting, kids who have attention deficit hyperactivity disorder, they benefit greatly from behavior therapies.